Everyone's ready for a great conference? Good. I am here for just a few minutes to talk to you a little bit about our 4 messages from SAMHSA. And that is that behavioral health is essential to health, good, you can clap for that, that prevention works, that treatment is effective, and that people, in fact, do recover. And we have some things that are supposed to be up on the monitor here. There they are. So I want to spend just a few minutes with you talking just about the public health challenge and the public health opportunity, and hopefully make the case that behavioral health is the #1 behavioral health or public health challenge in our country today. I want to talk to you just a little bit about the global and domestic impacts of behavioral health, and I want to tell you a little bit about what SAMHSA is doing to try to change the conversation and ask your help in doing that, and also offer you help in doing that as well. So let me start with a little bit of data. We've heard some rousing speeches, so I'm going to try to do some data work here. By 2020, mental health and substance use disorders are going to surpass all physical disorders as a major cause of disability worldwide. Now think about that. We don't talk about it that way, but that is in fact the case. CDC has come out with some new data recently that half of all Americans at some point in their lifetime are going to experience a mental illness, a mental disorder. What that means, everything from minor depression to major anxiety to post-traumatic stress disorder to psychotic illnesses to addiction to alcohol, cocaine, methamphetamine, a number of disorders, but half in our lifetime, in a United States adult's lifetime. What we know is that mental and substance use disorders is the 3rd most costly health condition behind heart condition and injury-related disorders. And we also know that combined with heart disease, mental disorders and heart disease reflect 70% of the lost productivity in our country. Mental and substance use disorders represent about 1/4 of all the stays in community hospitals, and 30 to 44% of all cigarettes in this country are smoked by people with mental and substance use disorders. We also know that for people with serious mental illness, about 83% of them are dealing with obesity and diabetes, partly from the medications and partly from nutrition and lifestyle issues that we can in fact prevent and work on. Now, in a day when we're talking about economics of healthcare and when we're talking about the economy, the costs of healthcare and the costs of behavioral health are important. So deaths and disease are an issue that we look at with behavioral health. We don't think about it that way often, but drug deaths now outnumber traffic fatalities in this country. And people with serious mental illness have shortened lifespans with high rates of comorbidity. Almost 70% of adults with serious mental illness have at least one medical disorder. And when people with medical disorders have comorbid behavioral health issues, again, whether depression, addiction, or otherwise, the cost of treating their health condition is higher. So healthcare costs with comorbid behavioral health conditions, for hypertension, it's 2 times the cost. For coronary heart disease, it's 3 times the cost. And for diabetes, it's 4 times the cost. There are nearly 5,000 deaths in our country every year because of underage drinking. And a lot of that occurs on college campuses. And deaths by suicide now outnumber homicides, and they outnumber deaths from HIV/AIDS. If you look at the reasons for death in our country, or the causes of death, heart disease is #1, and we have cancer and diabetes and stroke and other issues. Suicide is #10 for all ages and all populations. If you are among certain populations, such as Native American populations, the number is higher. Suicide is a higher portion of the deaths. The tough realities about suicide is that we think about the deaths. There's about 36,000 per year, about 1 every 15 minutes. People in America die by suicide. And yet the numbers of people who think about suicide, who create a plan for suicide, and who actually attempt suicide is much higher. So 11 million people ages 14 and higher had a serious thought of suicide. That's a lot of distress. And over 5 million people made a plan, and about half of those actually attempt suicide. And then the deaths are about 36,000 a year and growing. Unfortunately, we have missed opportunities, lives lost, missed opportunities. 77% of individuals who die by suicide had actually been to see their primary care doc within the year prior to that, and 45% of them had been there within the month before. For people who are elderly, where the suicide rates are the highest, 18% of elderly patients had actually been to their primary care doc that very day. And in all of those cases, the question of suicide was seldom raised, or the question of mental health or emotional health. And we think we can change that. Now, we also have a growing understanding of the impact of trauma, especially childhood trauma, on both children and the effect of child trauma on adults. So childhood trauma, we understand, is much more extensive than we understood before. About 6 in 10 United States youth will be exposed to violence, either as a witness or as a victim. And about 772,000 children are going to be victims of maltreatment. This is 2008 data. I'm sure many of you are familiar with the adverse childhood experiences data that started with Kaiser Permanente and has been continued with CDC, where physical, emotional, sexual abuse, as well as family dysfunction are associated with mental illness, with suicidality, with substance abuse, and frankly, with physical illnesses in adulthood. And almost a third of adult mental and substance use disorders are explained by childhood trauma. There's an IOM report out. If you haven't seen it, I encourage you to look at it. It's Preventing Mental, Emotional, and Behavioral Disorders Among Youth: Progress and Possibilities. And in 2009, the IOM made it very clear that prevention does work. They also gave us some sobering statistics, and that is that among adults, about half of all the mental, emotional, and behavioral disorders start before the age of 14, and almost 3/4 before the age of 24. That means addressing mental and emotional and behavioral health in young childhood, as well as in adolescence, is very critical to adult disorder. They're very commonplace for youth, almost as commonplace as a fractured limb, and it would never occur to us not to get treatment for a child who broke his leg or broke her wrist. The risk and resiliency factors are there. We can identify them. We know how to address them. We know that common, early, consistent, multi-sector, continuous, and community-based public health approaches actually make a difference for childhood issues. And we know that environmental, policy, cultural, and individual approaches work. So prevention does work. There's good information. We have some of that and can help you with that. Global impact of chronic diseases, there's new information. The World Economic Forum just finished a study, and the thing that's important about this study for people with mental health issues is that mental illness was included in this for the first time. In world health discussions, sometimes mental disorders are not included. In this case, it was. And the 5 major illnesses that have major global economic impact are cancer, diabetes, mental illness, heart disease, and respiratory disease. Of those 5, out of those 5, about $47 trillion is going to be the cost of those diseases over the next 20 years. Now, these are global data, but when we're in the United States talking about how to deal with trillion-dollar deficits, I think we need to pay attention to where the costs are coming from. And mental health, it is now determined, will account for about $16 trillion, almost a third of that cost worldwide. In the United States, new data shows that the economic impact in America of these diseases is substantial. So for the social costs of substance abuse, it's over $500 billion every year. For mental, emotional, and behavioral disorders among youth, it's almost $250 billion, the cost. For alcohol, drug abuse, and dependence, it's about $263 billion. And for mental disorders alone, about $94 billion. Now, when we're talking about how to bring down the healthcare costs in our country and how to address the economic issues in our country, I think we have a solution. The problem is that we know that treatment's effective, but unfortunately, treatment in America of people with substance abuse and mental health disorders is very low. So just comparing with some of the diseases we talk about a lot, with diabetes, heart disease, and hypertension, somewhere between 70% and 85% of people with those diseases get some kind of treatment. Whether high quality or not, I don't know, can't say in these data. But for mental and substance use disorders, for people with mental illness, only about 38% receive any treatment, and for people with substance use disorders, Only about 11.6% receive treatment. These are major disparities that we can't deal with if we don't get that treatment out there, and we are now thinking about that as a daily disaster. So when we combine the fact that prevention and treatment work with the costs of untreated mental illness and the numbers, we know we have a major public health issue. Now, SAMHSA has recently started thinking about this in a very big way and saying, why is this? And we think there is a very fundamental issue that goes along with all of the stuff you've heard this morning already from your speakers, and that is we're not looking at the big picture. So the balance in our country tends to balance behavioral health and thinking of it as a social problem with a lot of blame, with a lot of attention to symptoms, rather than a public health problem with attention to the health needs of people and communities. We want to create a national dialogue that changes this. Unfortunately, the most of the time when the nation gets engaged around talking about mental health and addiction disorders, it is around major tragedies, whether that is Columbine or whether it is Fort Hood or whether it is the Red Lake Band of Chippewa suicide or whether it's Virginia Tech or whether it is unfortunately something like Asher Brown, who committed suicide after having been the victim of bullying. That's when people engage around behavioral health at a public level. So unfortunately, from those kind of events, if you watch the newspapers and you watch what the reactions are from the public, it's often assumptions about blame. So we get misunderstanding about the illnesses and about what causes them. We get prejudice about those individuals or their families or the school systems or the delivery systems. We get discrimination against individuals with those disorders, and we get moral judgments about these are just bad choices people are making, or these are issues that the family or someone else should have taken care of, and we get social exclusion. So those are the reactions to those public tragedies, and that's when most of the dialogue occurs. That dialogue then leads to what we believe are insufficient responses. They lead to things like, let's figure out how we can increase security or police protection. Let's figure out how we can keep people with mental and substance use disorders or histories of those from getting access to weapons. Let's think about how we can control perpetrators or mandate their treatment. Let's think about how we can have more jail cells or more homeless shelters or more juvenile justice facilities, and let's think about how we can implement institutional and system changes for provider oversight. Those are our responses, and they're insufficient for a public health problem. Most Americans know something about basic first aid. They know something about heart attacks, they know something about chest pains, they know something about basic nutrition and physical health care, and they know something about where to go and call for an emergency, in an emergency. We teach our children this, we teach our workers these things, we teach each other these things. Most Americans don't know the signs of suicide. Most of them don't know addiction or mental illness signs or what to do about them and how to find help for themselves or others. Most Americans, frankly, don't know how much alcohol it is appropriate or okay to drink. Most Americans think that it's okay for 19-year-olds on college campuses to binge drink. That's kind of normal. It's not. It's illegal. And it has a developmental issue for those individuals. Most Americans don't know about the relationship of behavioral health to individual or community health or to healthcare costs and what it does to our communities. And most people don't know the relationship of childhood trauma to adult physical and mental and substance use disorders. We think we should change that. So SAMHSA is about the process of thinking about how to develop or how to create a national dialogue about the role of behavioral health in public life. We need your help. We want to take a public health approach that engages everybody, not just people who have these disorders, not just people who experience these things, not just families of children who are struggling with them, and not just people who are in the business, but clergy and school teachers and parents and community coalitions and neighbors and friends. We want to base it on data, on facts and science and common understanding and messages. We want to focus it on prevention because a lot of people still don't think prevention works and don't understand that prevention of mental and substance use disorders is in fact possible. and that it can create healthier communities. And most are committed, we want to be committed to the health of everyone. So not just the people who can afford health care, not just the people who have enough money or who have a place to live, but the social and public health of everyone. So we want to ask your help. We have what's called a wicked problem of how do we get people to change the behavior. Wicked problem is a good thing for a Halloween weekend. We want to engage you around this wicked problem of how do we get the public to think about the fact that there is no health without mental health. So we want to offer you some resources and some information. On our website is a document that talks about lots of these issues, lots of data, talks about our 8 strategic initiatives. We want to provide you with information about that at our booth 4020 in the exhibit hall. Please stop by and get information about that. And we want to ask what we can do for you in order to get this message out. So behavioral health is essential to health. You can't do public health. You can't have final public health. You can't have good health without having good emotional, mental, and behavioral health. I really appreciate the opportunity to be here, and I want to offer you, again, SAMHSA as a resource to you in the federal government and as you go about your business. Thank you very much, and have a great conference.